Hello and welcome to this session of Nurse Digest. I'm Dr. Dempsey. I work with APNA, and APNA is collaborating with the Australian Digital Health Agency for Nurse Digest, a monthly series of bite-sized education sessions about the use of My Health Record. A quick bit of housekeeping that please put any questions that you have into the Q&A section at the bottom of your screen, and hopefully we can get to answer your questions. This session will be recorded and slides will be available for you, will be sent to you as well. So if by any chance you miss out, this webinar is being recorded. I would like to, on behalf of APNA and the Australian Digital Health Agency, acknowledge the Aboriginal and Torres Strait Islander peoples as the traditional custodians of the lands across which we meet today. And I'd like to pay my respect to their elders past, present and emerging. I'm speaking to you today from Wathaurong country. I'd now like to introduce Nicola Graham, who works with the Australian Digital Health Agency. And Nicola is going to deliver the presentation today about uploading to My Health Record and the role that the nurse plays in that. So welcome, Nicola, to today's session.
Thanks so much for that, Marg. I'm really happy to be here. All right, so before we get started with the uploading, I really thought we'd like to talk to you about advanced care planning. So as COVID-19 continues to destabilise our already stretched healthcare and aged care services, there's a strong case for prioritising advanced care planning as part of the COVID-19 response. Having an end-of-life planning document or a custodians of an advanced care plan or a directive readily available in a My Health record can help reduce the risk of non-adherence to advanced care planning directives of the patient and promotes dignity and of the resident and their wishes. Now, there are some enhancements to the My Health record, which has included functionality to allow the upload of an advanced care plan and a goals of care document by healthcare providers. However, the software vendors still need to build this function into their systems to enable the healthcare providers to be able to upload these documents. So it's certainly a space to keep watching for, and I would certainly encourage you to encourage the clinical information systems or the vendors to be able to start to do that. All right, so what is the nurse's role? And it's not just up to the nurse. Everyone in the practice has a role to play in the successful implementation of My Health Record. Now, this includes practice managers, reception staff, nurses and GPs, and any other healthcare providers who work in the organisation. So today, I really wanted to go through with you the two documents that are uploaded by a general practice. And the first one is the Shared Health Summary, and the second one is the Event Summary. So let's look at the Shared Health Summary first. So what is a Shared Health Summary? It is the first document that is most likely to be accessed in a patient's My Health record. The Shared Health Summary captures the patient's health status at a point in time, and it contains medical information in 4 key areas. And they are allergies and adverse reactions, current medications, relevant medical history, and of course immunisations. Now, we know that sometimes a Shared Health Summary has been uploaded after an immunisation and leaving the other field blank. And as you can see, this leaves out key health information and it doesn't reflect the patient's health status at a point in time. Now, a Shared Health Summary can be uploaded at any consultation and should be uploaded when there has been a change to the patient's clinical information. So, who can create a Shared Health Summary? Now, this document is uploaded by the patient's nominated healthcare provider organisation, which really means the patient's regular GP practice. And it can be uploaded by a registered medical practitioner, a registered nurse, an Aboriginal and Torres Strait Islander health practitioner with a Cert 4 in Aboriginal and/or Torres Strait Islander primary health care. So it is important to note that an enrolled nurse is not permitted by the Act to author or create a Shared Health Summary. And a medical assistant or an assistant in nursing who are not part of a regulated industry are not permitted to author any documents in a patient's My Health record. So the next document is the Event Summary. So what's the purpose of the Event Summary? The event summary captures key health information about a significant healthcare event, and it's relevant to the ongoing care of the patient. Now, the types of care events that could be recorded in an event summary really varies depending on the healthcare sector uploading the information. And who can create an event summary? The event summary can be uploaded and created by any healthcare professional who has a health professional identifier. And once again, a medical assistant or assistant in nursing are not permitted to author a document in a patient's MyHealth record. An EN can author and upload an event summary. Now, in a moment, I'll go through a demonstration on how to create and upload each of these documents in a bit more detail. But before I do, I thought I'd go over with you when you can view and upload information to a patient's MyHealth record. So firstly, must you view MyHealth record for every patient? Healthcare providers are under no legal obligation to use a MyHealth record system, and it's really up to the healthcare provider and his or her clinical judgment as to when and how they use the system. And do you need to obtain consent and to view and upload to a patient's MyHealth record? So under the MyHealth Records Act of 2012, healthcare provider organisations are authorised to upload information to a patient's MyHealth record and view the information in the system. Now, generally, this means that healthcare providers do not need to obtain consent prior to uploading information to the record when providing services to that patient. Now, there are some situations where documents should not be uploaded, and this is a condition of your organisation's registration with the MyHealth record system. So if a patient requests that a particular document is not uploaded to their record, healthcare providers must comply with these requests. In addition, patients can restrict access to or remove information contained in their record. Now, you can advise the patient about the potential risks of excluding information from their MyHealth record and also explain the benefits of ensuring all the information is included. However, you must comply with their final decision and not upload that information if it is requested. So any person who is authorised by a healthcare organisation can access and view the individual's MyHealth record for the purposes of providing healthcare services. So in addition to clinicians, a healthcare organisation may authorise other staff to access the MyHealth record system as part of their role in the healthcare delivery. All right, so I'm just going to stop the presentation now and go into the next part, which is the shared health summary. So what you're looking at here on the screen, Mark, can you confirm you can see the screen now with best practice?
Yes, I can. Can you hear
Perfect.
me? Yes, I can.
Yes, thanks for that. Just want to confirm, just in case, we've got technology is wonderful. All right, so this particular version is best practice, and I'm going to show you for the shared health summary. Now, as I said before, a shared health summary can be uploaded at any consultation, and it should be uploaded when there's been a change to the patient's clinical information. So to help encourage and make uploading a shared health summary business as usual, maybe you could consider including this as a QI activity, and you could start with a particular cohort of patients. Now, for example, your diabetic patients. Now, the activity could be that every diabetic patient has a shared health summary uploaded at the end of every appointment they attend. So RACGP recommends that a healthcare provider creates and uploads a shared health summary when completing a patient health summary, because this is a time when the health summary within the GP clinical system is being updated. So it is also a good opportunity to introduce uploading of the shared health summary for all health assessments at the practice. So this is Caleb Darrington, and today I've given him a health check, an over the 75 health check. Now, when you're going through this, and I think our next session will be about data quality, but it will be the practice GP or registered nurse who may be going through to confirm all the details are correct. So when we want to do this, it's done at the end of the consultation, when you've gone through and made sure that all the medication's up to date, all the relevant medical history is correct, that things are coded correctly. And so simply, that's part of the everyday practice. So the health check's over and you've completed that for the day, then you go to the My Health Record tab and then choose Create Shared Health Summary. Now this opens up the My Health Record. And here you can see the reason why it's really important to have all that information up to date. So if you didn't, you'd have to spend time in this area unticking. So if this was something that Caleb wasn't taking anymore, you would have to untick it. And as you can imagine, there'd be quite a lot of information in here if it's not cleansed in the system itself. So by doing that, this is simply a check this information and make sure that everything's okay. And then you simply press preview. Now this will bring up a preview screen, and it gives you another opportunity to review the information in the patient's shared health summary to make sure again that you're happy with all the information, because as I said, the shared health summary captures that patient's health status at this particular point in time. That's just taking a little bit longer. So uploading a shared health summary, if you make it part of this usual process, you'll be able to easily meet your EPIP requirements too. Now, this is the shared health summary. So basically, again, simply review the document. So here you can see the adverse reactions, the medications, the medical history, and the immunisations. And before I mentioned that sometimes we know that immunisations just get uploaded. So you can imagine how much of a problem it can be when there's no other critical key information in here. So making sure that all the information is correct, and then simply choose upload. So, and it will then tell you that the shared health summary has been successfully uploaded. Now, I mean, I spoke to you a little bit through that to explain the steps, but in essence, when everything's up to date in your record, the shared health summary doesn't take very long to upload. And then as part of the actions in the best practice, it shows that the shared health summary has been uploaded to the patient's My Health record. So you can see that if you did this at the end of every health check, or if you did this at the end of diabetic patients, and you just sort of targeted that area as part of a quality improvement, then it could become normal business. That is something that you automatically do, because I guess that could be part of the problem. Now, not only will, as I said before, be able to easily meet your EPIP requirements, really more importantly, your practice is contributing to the continuity of care for this particular patient. Now, the next one we'll go through is the event summary. So we'll just go into Medical Director. And if you're all looking at this thinking it'd be great to use, we can certainly give you a link to the on-demand training centre, so you can go in here and have a play as well, so you know what you're doing. So once again, the event summary, so it depends the types of events that could be recorded in the event summary. It really, as I said before, varies depending on the healthcare sector. So if this was an allied health provider, well, their information is going to be a lot different. So the event summary really can indicate a clinical intervention, an improvement in a health condition, or indicates that a treatment has been started or even completed. So for the example of wound management. Another reason you could use the event summary is for a patient who maybe have visited your practice, that they're not your normal patient. So any of the information that you're recording about that patient can be recorded in this event summary, and that captures it really well for their own healthcare provider. So even if you've provided travel immunisations, an event summary is probably a good one to put up as well. So once again, the event summary is completed at the end of your consultation. So basically this is Medical Director, we'll go to the My Health Record tab and open the My Health Record. And as you can see, I've done a few bit of information in here, so we've got something to add into the event summary. But this is why it's so important to do this at the end of the consultation. So in Medical Director, we'll go to Create Clinical Document. Then we're going to choose CDA Event Summary. Now you can double click to open, or you can select OK. So this opens up the event summary window. Now in here, you can either freehand a typed message. So if you wanted to put something specifically in here that wasn't in your clinical notes, you could add that in here, or you can simply choose Import Progress Notes. But say there's something in here you actually didn't want to have in the event summary, then you can simply delete and edit this area. So then as you scroll through, you can add information. So here we can see newly identified allergy. So if there was a newly identified allergy, that would show here. If you're not sure and you wanted to add something, you would click on the More button. So as we can see here, this is not a newly identified allergy, it is one previously. So if you wanted to add penicillin, because this is about a wound, then you could certainly add that into the event summary. The next is medication. So you can include ceased medications. So if this was a patient that was not your patient and you had ceased a medication, then I would include that ceased medication in this so that the provider knows what's happened. So once again, if there's nothing here, click on More. And so what we can see here is that this is a new medication. So we've provided Septrin Fort and also there should have been some Panadol too, but no, that's all good. So we know, because this is a patient that you've been working with, that Septrin Fort is a new medicine. So we'll add that to this particular event summary. So any diagnoses and interventions. So clicking on More, and we can see here, these are all his previous diagnoses. So in there, we have not made a diagnosis of wound care. So there won't be anything in here to add. And you don't necessarily need to add everything into every single area. So the next is procedures. There's no procedures done, and any other medical history. So in here, the other medical history and medical director has come up with wound care, and we certainly will add that into this event summary by clicking. Any immunisations. So we can check here to see what he's had done. And if you had done a tetanus injection, you've given him a Boostrix, then you could certainly add that information in here. And then as we go down, we can see at the bottom here that there has been some outstanding requests, and I do apologise, it won't go up any higher. So these are the outstanding requests. So you can click on this to make sure that you add it, because this will save another provider, or if Caleb ended up at hospital, for them to know that they'd already had this information ordered, so they don't have to repeat that test. Once again, when you're finished with this one, we go up to the little icon at the top of the screen that says Send to My Health Record. It doesn't actually send it straight away. It opens up a preview screen. And here you can see the synopsis about the event. And so what we've written down here, and then any adverse reactions, the medications, it lists the diagnosis interventions, and it also shows the requested service. So it doesn't show that there's a result, but it actually is saying that it is pending for results. Once you're happy with this document, you can simply press send. And that then has been uploaded to the patient's My Health record. Now, if I've gone quite fast today and you sort of missed anything, I've got another slide on this, but this is our How to Use My Health record. It's a training at digitalhealth.com. And I can send that link through to Marg. So here you can do view medicines and also how to upload a shared health summary. And by just clicking through, it'll show you a few different ones, and hopefully you can all see this still. So here you can see, you can learn how to upload a shared health summary in these 5 different CISs, and you just simply click on it and it will take you into the actual shared health summary. All right. So now I'll just share my screen again for the presentation. So you can all see that still, hopefully. All right, so that I was just showing you the free online training modules. Now I did show you how to access, how to view a My Health record and how to upload a shared health summary. But in there, there's also some online learning modules that would be fantastic for you. And there's a whole range of them. And it doesn't show here, but there is also an online module for nurses as well. All right, so that takes me to the end of the presentation today. So we can have some questions now. Thanks, Mark.
So I've got one of the questions. How can you upload documents from the notes, such as a CDM plan?
So you're talking about like a care plan? Is that what it is?
Sorry, so, unfortunately, that's all the information.
Yeah, so currently a care plan is not able to be uploaded to the patient's My Health record. So that would be, you could actually put something into, I know the care plan is a specific document, you could actually put that into an event summary, but currently there is no mechanism to be able to upload that CDA document to the patient's My Health record. I'm sorry.
Mm-hmm. Yep, and someone's just stating that they'd like a link to the training resources.
Yeah, absolutely.
Yep. The next one we've got is, can you upload under amended items? That is, if you if completed over 75 health assessments 2 weeks ago and it wasn't uploaded then, can you upload at a later date but on the date completed?
You certainly would be able to upload. So if you're talking about uploading a shared health summary after that event summary, as long as that is relevant for the patient's ongoing care. And as I said before, that shared health summary contains key clinical information. So if you wanted to go back and in hindsight upload that shared health summary, but keeping in mind, as long as all that information is updated and it's current at the point of care and the point you're uploading it, so that from, say you uploaded it today and you'd done the health assessment 3 weeks ago, you need to make sure that all that information in that shared health summary is up to date and current at the time you upload that shared health summary.
Yep. So someone's asked, where can you see when a GP management plan has been done?
Yeah, sure. I can actually show you that. Hopefully you can still see my screen. I'll just close that, go back into here. So I'll just show you in Medical Director. Oh, actually, I might show you in Best Practice. It's a bit quicker. So this is, so if you're looking for the MBS item numbers in a patient's My Health record, you need to look under the Medicare data. Now it does have 2 years worth of PBS and MBS Medicare data history that's available in the record. So here you can see it's not actually showing in this. You need to refresh, and in majority of the CISs you need to search for it. So here you can see exclude Medicare documents. Simply untick that and then choose update. The Medicare document shows in a patient's My Health record in 2 ways. One that shows Medicare documents for 12 months and Medicare documents all. So you can see here that's the all and that's the past 12 months. Now you can choose either, but because this is a practice area, we always go the all because it makes sure that we can provide you information because it is dummy data as such, but you could just choose 12 months. So this is the Medicare overview, and here you can see the first part is the prescription information, so that's a PBS and RPBS information. Scrolling through, you can see the Australian Immunisation Register, and then the organ donor, and then here is a Medicare services. So as I said, this is just dummy data, but obviously you can see the date the service was, the item number, which is important. So here's the 23, and then who actually did that service. So I hope that helped.
Next one, so in best practice, can you see who and when and what was uploaded under the patient file?
So you're talking about in the patient's My Health record?
Yep.
All right, so this is looking at the patient's My Health record here. So this is from any provider or healthcare provider that's uploaded to the patient's My Health record. So if you're looking for information, that should be all here. If you're looking for something specifically, then you could do the medicines view, and opening the medicines view gives you access to, very quickly access to the information. So you can quickly see allergies, adverse reactions. You can see the latest shared health summary, if that's the information you're looking for, the latest discharge summary, and of course the medicines preview. So here you're able to go through the medicines. Now you can actually source this by clicking on medicine, active medicine. So what it will do then is show you the medicines first. So if you're looking for something about aspirin, you could see that this one here is actually part of this document, and by clicking on it, it takes you to the original source document, so you know where the information came from. Any information that you upload to your patient's My Health record should show in the patient's demographic information or in the patient's clinical notes to say that you've done that. Whoever has asked that, I hope that covered that for you.
So someone's just kind of made a statement. So in regards to just uploading immunisations due to data cleansing, because you're putting your name as the author, some of the nurses aren't comfortable with adding the past history and allergies, as their doctors do not like us changing things in the patient notes.
Yes, absolutely. So Mark, feel free to chime in here, but in that instance, you can upload an event summary if you're wanting to make sure that information goes up to the patient's My Health record. Because as I said before, uploading a shared health summary without that other key health information really isn't accurate, and that's not the purpose of that document. So I would actually upload an event summary in that instance. So Mark, did you want to add anything to that? No, that's good.
So will uploading of CDM-HA be available in the future?
I'm not aware of anything at this stage. I think it would be fantastic, but I'm not sure about whether that's being part of the enhancements. There are quite a few enhancements that happen all the time, but at this stage, I don't believe there is at the moment, no.
Mm-hmm. Do we know the percentage of clinicians that are actively using My Health record?
There is some stats I don't actually have on this slide, but across Australia, there is, now I hope this is right, about over 80% of GP practices who are actually contributing to the My Health record. And that doesn't just include GP practices. So we've got pharmacies, there are some specialists, certainly pathology and diagnostic imaging, and also hospitals are also uploading to the patient's My Health records. So there's a lot of clinical information there that like years ago obviously wasn't, and now there's so much more, and there's more enhancements coming. Like I just showed you the medicines view. There's also a pathology overview, because now there's more and more pathology going onto the patient's My Health record that we needed to be able to make sure that you could source that information quickly. So there are a lot of documents and a lot of healthcare providers that are now using the My Health record.
Mm-hmm. So when I've tried to use the simulations, the layout differs from what I see in best practice. Will this be updated?
So I wonder what software you actually have, what version. My understanding is this is actually probably the version before the new, I think there was a release just recently for best practice, but we do try to get the most recent versions uploaded, appearing in our on-demand training. So I guess the information in here is, and if you're using it to practice on My Health record, that won't change much, because we know that when best practice upgrades, they only upgrade certain things. And I knew the new upgrades around the electronic prescribing, and there's some other enhancement they've made as well. But certainly, as soon as we can, we will certainly update our ODT as well.
Yep. And so if someone's chosen to join My Health record and then they change their mind, what do we need to do then to upload?
So if a patient has changed their mind and I'm hoping there's, not really sure about the question. So if they had a My Health record previously and they've decided they no longer want one, they can cancel and delete their record at any time. So there just won't be a record for you to upload to. So on my screen here, you can see around the My Health record, it's green. Sometimes it's got a red highlight around it, which means that the patient may have a control in place, or the patient doesn't have a My Health record. So you actually can't upload because you can't click on that button. So you would not be able to upload. You could have that conversation with the patient to say how much of a benefit it is to them and encourage them, but that's completely their choice.
Yeah, and this will probably be the last one that we have time for.
Yep.
So can you confirm what was mentioned in the beginning around uploading of ACDs from general practice? Am I correct in saying the functionality has been developed and merely is required to be incorporated into the various CISs? If so, yes. Who dictates how quickly that progresses?
So that's so each vendor needs to build that functionality within. So the first part of that is the My Health record system being able to allow that functionality, and so that part of that enhancement has been completed. So now it's really the systems, and I would encourage you to whoever CIS you use to contact them and just say when are they going to build that functionality in, because I wouldn't know what their timeframes.
Yeah,
thanks, Nicola. That will end the Q&A section at the moment. Can you just move now that your slide back off to the next to the final slides of the presentation?
Yes, I can.
Thank you. And I will, while she's doing that, I will just remind everybody that if you'd like to continue this conversation and be asking questions and learning from each other, APNA encourages you to join their new My Health Record community of practice, where you can share learnings with others and you have access to an experienced APNA nurse moderator and also access to the Digital Health Agency clinical educators. So if you'd like to join the community of practice, just get onto the APNA website, apna.asn.au, and you can use the search function for communities of practice, and then there's a process of how you can join and we can get onto there. So I do thank you this afternoon, Nicola, for joining us and providing that good information. Just to let everyone know, the next Nurse Digest session will be on the 1st of October this year. As Nicola said, we're looking at data quality, so updating the My Health record, and how do we know that the information is current and making the information current. So I urge you to join us next month for the next edition of Nurse Digest. So thank you. Have a good day. Stay well.
Thank you.